Sexual sadism disorder represents one of the most complex and concerning paraphilic disorders within the spectrum of human sexual behavior pathology. This condition, formally recognized in the Diagnostic and Statistical Manual of Mental Disorders, involves recurrent and intense sexual arousal derived from the psychological or physical suffering of others. The disorder goes beyond mere fantasy or role-playing scenarios, manifesting as a persistent pattern that significantly impairs an individual's functioning or causes distress to themselves or others. The clinical presentation of sexual sadism disorder typically emerges during late adolescence or early adulthood, though its roots may extend back to childhood experiences of trauma, abuse, or exposure to violence. Individuals diagnosed with this condition experience sexual excitement specifically through acts that involve dominating, humiliating, or inflicting pain upon their victims. Unlike consensual adult activities that might involve elements of dominance or submission, sexual sadism disorder is characterized by the lack of consent from victims and the escalating nature of the aggressive behaviors required to achieve sexual satisfaction. Understanding the neurobiological underpinnings of sexual sadism disorder requires examining the complex interplay between brain chemistry, hormonal influences, and psychological development. Research suggests that individuals with this disorder often exhibit abnormalities in areas of the brain responsible for impulse control, empathy processing, and reward mechanisms. The amygdala, prefrontal cortex, and limbic system frequently show altered activity patterns that may contribute to the disinhibition of aggressive sexual impulses and the diminished capacity for emotional regulation. The developmental trajectory of sexual sadism disorder often involves a progressive escalation of harmful behaviors. Many individuals begin with seemingly less severe forms of aggressive sexual fantasy or behavior, which gradually intensify over time as tolerance develops and greater levels of victim suffering become necessary to achieve the same degree of sexual arousal. This escalation pattern makes early identification and intervention crucial for preventing more serious criminal behaviors and protecting potential victims from harm. Diagnostic criteria for sexual sadism disorder require careful assessment by qualified mental health professionals who must differentiate between consensual adult sexual practices and pathological patterns of behavior. The disorder is diagnosed when an individual experiences recurrent sexual arousal from inflicting psychological or physical suffering for at least 6 months, and when these urges cause clinically significant distress or impairment in social, occupational, or other important areas of functioning, or when the person has acted on these urges with non-consenting individuals. Treatment approaches for sexual sadism disorder typically involve comprehensive psychological interventions designed to address both the underlying psychological factors and the behavioral manifestations of the condition. Cognitive behavioral therapy remains the primary evidence-based treatment, focusing on helping individuals develop insight into their harmful patterns of thinking and behavior while building healthier coping mechanisms and interpersonal skills. These therapeutic interventions often include components such as cognitive restructuring to challenge distorted thought patterns, empathy training to enhance understanding of victim impact, and relapse prevention strategies to manage high-risk situations. Pharmacological interventions may also play a role in treatment, particularly medications that can help reduce sexual drive or aggressive impulses. Selective serotonin reuptake inhibitors and anti-androgen medications have shown some effectiveness in clinical trials, though medication alone is rarely sufficient and is typically combined with intensive psychotherapy. The goal of treatment is not merely symptom reduction, but the development of genuine empathy, improved impulse control, and the establishment of healthy, consensual relationship patterns. The societal implications of sexual sadism disorder extend far beyond individual suffering, affecting families, communities, and the broader criminal justice system. Many individuals with this disorder eventually come to legal attention through criminal behaviors, highlighting the importance of early identification and intervention within healthcare systems. Law enforcement professionals, legal experts, and mental health providers must work collaboratively to balance public safety concerns with the potential for therapeutic intervention and rehabilitation. Prevention efforts focus on identifying risk factors during childhood and adolescence, including histories of abuse, exposure to violence, and early signs of aggressive or antisocial behavior patterns. Educational programs aimed at parents, teachers, and healthcare providers can help improve recognition of warning signs and facilitate early referral to appropriate mental health services. Additionally, research into the underlying causes of sexual sadism disorder continues to evolve, offering hope for more effective prevention and treatment strategies. The ethical considerations surrounding sexual sadism disorder treatment involve complex questions about individual autonomy, public safety, and the potential for rehabilitation. Mental health professionals must navigate these challenges while maintaining their commitment to both individual patient welfare and broader social responsibility. This includes careful assessment of treatment progress, ongoing risk evaluation, and coordination with legal authorities when necessary to ensure public safety. Future research directions in sexual sadism disorder focus on improving our understanding of the neurobiological mechanisms underlying the condition, developing more effective treatment interventions, and identifying reliable predictors of treatment success. Advances in neuroimaging technology and our understanding of brain function may eventually lead to more targeted therapeutic approaches, while longitudinal studies of treatment outcomes can help refine existing intervention strategies and improve long-term prognosis for individuals affected by this challenging disorder.